I'd like to ask if the Minister will outline the Department's plans to provide support for healthcare workers experiencing long COVID as a result of their service, her plans to provide recognition of long COVID under the Social Welfare Consolidation Act 2005, and if we can have a statement on the matter.
Minister.
And thank you, Deputy Horrigan. Section 87 of the Social Welfare Consolidation Act 2005 legislates for the Occupational Injuries Benefit Scheme for persons injured by an accident at work or caused by a prescribed disease due to the nature of their employment. The Occupational Injuries Benefit Scheme is a compensation and income support provided by my department, and as Minister I have the power to prescribe diseases under the scheme. COVID-19 is not currently a prescribed disease or illness. Section 87(2) of the Act states that a disease or injury shall be prescribed for the purpose of this section in relation to any insured persons where the Minister is satisfied that it ought to be treated, having regard to its causes and any other relevant consideration, as a risk of their occupations and not as a risk common to all persons. And B, it is such that, in the absence of special circumstances, the attribution of particular cases to the nature of the employment can be established or presumed with reasonable certainty. My department is aware of the recommendation of the European Commission regarding COVID-19. The decision on whether or not to recognise an illness as an occupational illness is a Member State competence, and in this regard it should be noted that the European Commission has not made a recommendation about recognising long COVID as an occupational disease. Most Member States have not recognised long COVID. The UK Department of Work and Pensions presented a report to the UK Parliament in November 2022, which concluded that long COVID should not be considered an occupational disease due to the lack of evidence and the evolving nature of the illness. However, I have consulted with other relevant departments and ministers on the matter, and the responses received are currently under consideration. So I trust this clarifies the matter for the Deputy.
Thank you, Minister. Deputy Horrigan.
Thank you, Minister. I suppose I'm glad you brought up the principles of the Social Welfare Consolidation Act 2005, because I would argue that the people that we sent into our hospitals, and I don't just mean the nurses and the doctors, the healthcare assistants, the cleaners, the housekeeping, the catering staff, all those people were not able to shelter in place. They weren't able to stay at home and mind themselves like the rest of us. They had to go to work, and not only that, but they often had to go to work with PPE that was less than appropriate, and though that wasn't just a failing of the state, that was for reasons, COVID was a pandemic, and we all understand that there was difficulties there, but it's very hard to argue that people who are experiencing this post-viral condition did not contract it in the course of being continuously subjected to exposure to COVID-19 in their workplace in a way that the rest of us weren't. So I have raised this before. I raised this earlier in the year, and I brought up those principles to the Minister, to the Junior Minister, and I did highlight that the EU Advisory Committee on Safety and Health has recommended recognition of long COVID, and at the time I was told that the department would take that away and do a review of it and also consult with the Minister for Health, and I'm just wondering where we are with that.
Deputy Colin Burke wants to come in on this matter.
There was a huge commitment and dedication by medical staff throughout the COVID period when they were there to do the best possible job for people who had COVID or who had other requirement for medical care, and that dedication and commitment, and people did contract it as a result of their commitment. And I don't think that we can ignore that some people do have long COVID. They contracted it in their place of work, and that it should be given recognition at this stage. I think serious consideration should be given to providing for them, and in particular while they're continuing to receive medical care.
Thank you, Deputy Burke. Minister.
Good. Just can I say that I have consulted with the two ministers in relation to this, the Minister for Health and the Minister for Enterprise, Trade and Employment. We have got a response from both ministers, and my officials, they're currently considering the response that we have received. I'll be meeting with the ministers in due course to discuss it and discuss it further with them. Social welfare is only a small part of this. It's a cross-government issue, and it will require further work and consideration. The response to the pandemic, I might say, was a whole of government, and I believe that this will have to be dealt with in the same way. So ultimately, it will require a decision of government. But as I say, I plan to meet the Minister for Health and the Minister for Enterprise, Trade and Employment very shortly to discuss their views on it.
Deputy Horrigan.
I'll finish by saying that Ireland hasn't always had the best history in dealing with post-viral illnesses and recognising them early and giving people supports, and I welcome Deputy Burke's comments on it. We have seen some countries in the EU recognise long COVID and provide social supports to it. So France, Italy, Denmark, Sweden have all accepted that long COVID's not going away, and therefore we'll be experiencing people with long COVID for many years to come, unfortunately. And just to finish by saying that I completely accept the idea that this is an all-of-government response needed, and we have to decide as a society to support people. But what I would say is, in particular relationship to the social protection issue, we're often talking about fairly young people here. Do you know, people in their 30s and 40s, they have small children, they might be sick, not forever, but for 2, 3, 4, 5 years until they get back on their feet and into a place where they can actually work. And we don't really want to see people with that kind of ambition and ability put into medical early retirement, and there might be a better way of going about it.